So the first thing to understand is if you have vascular disease, it's really a biomarker, a sign that you may have other problems and that you're at high risk for heart attack and stroke. So the first thing that we do when we see patients with vascular disease is we want to evaluate them and try to minimize their chances of having a stroke or a heart attack. A lot of the times it's very rare that you may have symptoms until you're older in life. And symptoms themselves may be kind of vague. They may get what we call claudication, which means as you're walking you may have pain in your leg that stops you from walking. And then it gets better, then you continue to walk. And this type of symptoms, a lot of times people say, oh, they're related to old age. And they relate it to something else. And that sometimes makes that the disease goes on unknown for a significant amount of time. We've had a lot of different changes, the different types of the disease and how we identify the disease. So now we have better imaging tests to help us better evaluate our patients. So better examinations, better looking at the waveforms of how blood flow is going in people's legs, how we perform our examinations, how we correlate patients' symptoms or lack of symptoms to their examinations and what they may have. You'll see a lot of new technology in place, and not only for teaching, but for evaluation of patients and looking at patient anatomy in a very personal way. An example is you may have a CAT scan or a CT scan. We can then use that information to really look at your anatomy, look at it, put it into a computer to create a 3D model so the doctor may be able to evaluate a 3D model of your pathology, of what's going on, before they actually have to go and treat it. They can then use this technology, these type of models, and put them into computers and actually practice using simulators. So imagine a doctor doing a procedure on you, they've already practiced 2 or 3 times with your specific anatomy. Without a doubt, as a physician, as an educator, as someone who really cares about our patients, being able to come to Cayman and speak here and be able to show what new technology is available, is coming, gives us an opportunity to help even more people. And that's really what it's about.